look around your room, does it look like a bomb went off in it?
Yeah,
Are you kind of that type of person that your desk just reeks of chaos? Maybe you can't even find your bills because you just throw the mail and it just piles up and you don't like
right.
really deal with it. Those are all just like things that when they put them all together, you can say, hey, maybe I do have ADHD symptoms or traits. And if it's impacting you enough, you should get treatment. So,
Definitely.
and I wanted to mention before we get into the treatment, you mentioned about being spacey and not there. That is the number one symptom that women with ADHD report. You don't hear it
Sure.
as much with men, but with women and girls, girls and women are diagnosed with ADHD much less frequently than boys and men. And I think in part it's because people haven't really recognized how the symptoms manifest themselves in girls and women. But with girls and women, it tends to be more spacey, daydreamy. So they're not, as children, they're not running around and causing a lot of trouble, but they're just not there. And
Sure.
so you may recognize that in yourself if you're a woman watching, as well as, the guys, as you had mentioned. Now let's
Definitely.
get to the treatment side of it. What effective treatments are available? You'll talk about medicine, and I'll talk about kind of the psychotherapy side. So
Sure. So, in terms of treatment, obviously, the first thing you want to do if you have concerns that you do have ADHD is go to your primary care physician. And from there, whether depending on his or her comfort level, they can either tackle it themselves or send you on to a specialist, whether it be a psychiatrist, a neurologist, or another specialist that has more experience in ADHD treatment. And from my side of things, from the medication side of things, it's more stimulants such as Adderall, Strattera, Ritalin, which is more commonly used in the pediatric population. But they're really all stimulants. And there are some other medications, such as specific antidepressants, that are more effective for people with other health conditions that can't have stimulants, such as people with heart issues.
and on the psychological side of it, the most common type of therapy used would be cognitive behavioral therapy. But I do want to touch on what you kind of hinted at. Most people who have ADHD also have a coexisting disorder, whether that is depression, anxiety, substance abuse, oppositional defiant, conduct disorder, antisocial personality, the list goes on. But where there is one, there is typically another. So
Definitely.
working with a qualified mental health professional is very good. So most times you're going to want to have your medical side, whether that's your primary care, a psychiatrist, neurologist, etc. And then you're going to want to have your more behavioral treatment side, which is going to be a psychologist or a psychotherapist. Now, the psychologist or psychotherapist is going to help you come up with plans to better manage your behavior, perhaps modify your behaviors, understand why you do what you do, and how you can do better. Does that sound about right to you?
Yeah, that's perfect. Those two things in combination are much more effective than doing one or the other.
Absolutely. Now, we know from kind of broad based prevalent studies that 5 to 9% of the population has ADHD. But we're kind of thinking between the two of us that the poker population will probably present at higher numbers. So let's kind of talk about why that might be.